relevant issues affecting animals and pet owners today, how to avoid common problems, and how to extend the quality of life for your cherished companions. As a community advocate, I will also discuss important social issues that affect our city. I plan to showcase organizations and heroes who are doing amazing things to help others. Remember to tune in every Tuesday morning at 10, starting soon.
Do you want to relive the golden days of Stockton? Join Nate Knott on Stockton Alive every first and third Monday at 6 p.m. Tune into thevoiceofstockton.org.
This is a production for the voice of San Joaquin.
Porque nos vamos a enlazar
con el mero, el gallo de Zacatecas.
That's right, homeboy.
el de Empayá.
You got it, homeboy. Ahí les voy.
Dicen que soy poderoso, yo solo soy su amigo. No hace falta averiguar, saben a qué me dedico. Me gusta vivir muy bien, aunque me siga el peligro.
Nosotros somos los Tucanes de Tijuana y nos vamos directamente. Adelante, échale, primo.
Hay que hacer ruido para que se mire la polvadera. Ahí le va. Mi gente le gusta la neta. Escuche en su carro o en su avioneta. Si prefiere mejor en bicicleta o en casa de su suegra Petra. Sin pelos en la lengua. Sin pelos en la lengua. Sin pelos en la lengua. Se escucha la neta. Hay que hacer ruido. Sin pelos en la lengua. Hay que hacer ruido. Sin pelos en la lengua. Para que se mire la polvadera. Sin pelos en la lengua. Se escucha la neta. Es la neta. Una producción del DJ Mix para el nuevo Imperio Enterprises. Radializando. Sin pelos en la lengua. Sin pelos en la lengua. Es la neta. Sin pelos en la lengua. Sin pelos en la lengua. Gallo.
Yes, the voice of Stockton.
You know what I got? I got a picture of his
For more
face.
information on the voice of San Joaquin, go to tvosj.org.
The voice of San Joaquin and the voice of Stockton presents Connections, Peace and Justice Radio with your host, Bruce Giudici.
And good evening. It is April 29th, a Monday evening, the eve of the first hearing on a single-payer Medicare for All plan in the House of Representatives tomorrow. And so this evening we are going to discuss Medicare for All. And that's an idea, a plan that is slowly catching on and that people are starting to realize can be a reality. Once again, we have Max Heinemann and Dr. Kathy Mathis here, our resident experts in Medicare for All and single payer. And so welcome.
Oh, thank you.
There you are.
Nice to be here.
Yeah, it's great to have you guys because, this is a plan that is, I would say, is the most important domestic policy that we have right now, is getting our healthcare system straight. It touches on everybody, every family, every single person in this country has to, sooner or later, deal with a healthcare system. And right now, it is unaffordable. Right now, it is unattainable by millions of people because they cannot afford health insurance. Even though there has been an Affordable Care Act passed, for many it is not affordable. And for this country, it is very expensive indeed. So let's start with talking about what is happening tomorrow. Hopefully it's the start of a campaign or start of a information campaign on H.R. 1384, which is the House law for a single payer system. And so anyway, so which one of you would like to sort of start discussing what is going to happen tomorrow at a committee hearing and what can we expect to get out of that?
I think Kathy has the last word on that.
Yeah.
Oh, well,
the first word, really.
It's the Rules Committee that is putting together the hearing, and the Rules Committee makes the rules. So
Okay.
if this bill doesn't get past them, it's not going to go anywhere.
Okay.
So,
Okay.
but this is a historic first.
Yes.
There has never been a hearing to discuss the merits of Medicare for all single payer.
Right.
And so we should pat ourselves on the back because this was not done out of the goodness of the hearts of the Democratic leadership in Congress. This was done from the grassroots.
Right, indeed. I was looking at the most recent Connections issue that has the Earth Day plastered all over the front page. But on your page 5, you'll see that time to remind politicians of the healthcare crisis. It turns out that a member of the House Democratic leadership is accused of echoing insurance industry talking points after she raised concern about the price tag of Medicare for All without mentioning the significantly higher cost for the current for-profit healthcare system. And what she says is, I think the $33 trillion price tag for Medicare for All is a little scary. But what she's doing is she's referring to the Koch-funded Mercatus Center study that found that Medicare for All would cost 32.6 trillion over a 10-year period, and that's a huge number. But the study also found that Medicare for All could save the United States $2 trillion compared to the status quo over that same period of time. So it's not like that $33 trillion is being compared with nothing, like the healthcare system would cost nothing as compared to the Medicare for All. It would cost actually less. And so it's just shocking that this is the person who is heading up the re-election campaigns for representatives for the House of Representatives in 2020, and so
on the Democratic side.
Democratic side, and so she has that perspective, and so
we got our work cut out.
We have got our work cut out for us, but it's so for tomorrow's hearing, who can be the people who are going to be testifying? So there are going to be a bunch of single-payer advocates who are going to be able to spell out this case for this committee, right?
Don't count on it.
It's by invitation only.
By invitation only.
And there really are no major advocates for single-payer who will be speaking to this issue. Or there were not initially any. There's going to be an additional person who is a longtime activist. But otherwise, I can name the people, and I can tell you where they're from, and I can tell you what...
Yeah, that would be interesting.
The trend is, at least from either their perspective or from their organization's
Yeah, because really what we have is the discussion around, at every party you're going to be going to this summer or any family gathering or whatever is going to be affordability. How can we afford to have Medicare for All when we're going to be increasing, if we're covering everybody? How can we afford that? I mean, how can we're going to have many more people? I mean, how can we take increase our budgets and say that we're going to save any money?
Well, I can answer that quickly.
Yeah.
That if we keep the same health care that we have in 2020, it's going to cost $3.24 trillion
each year.
Medicare for All, even including a 12% increase in services, which since it'll be
so it'll cover everybody.
Everybody,
right?
With
that's
no,
the increase,
with
right.
no copay,
right?
And no deductible, and so you're going to have a 12% increase in service. Is going so with the healthcare we have and the insurance companies, that's $3.25 trillion.
Yeah.
The cost for Medicare for All would be 2.9.
So covering
trillion.
Everybody, but it would cost even less.
Right.
By about $300 million.
Yeah.
A year.
You say so.
Yeah. Well, that's the yeah. So it's $2.93 trillion covering everybody, or $3.24 trillion not covering everybody.
Not getting close to
right.
covering everybody.
And so without all the deductibles and co-pays and the premiums that keep on going up
next month.
Exactly, and worrying whether or not you can afford an accident that happens to you. So so that whole concept of I think a lot of times people sort of prey on on people's phobia of numbers and worrying, especially when you get to the trillion. I mean, trillion is a lot of money. You know, I mean, it's a huge economy. It's like 20% of our economy.
It used to be an unimaginable number that we never heard.
Yeah, but now we're saying it all the time.
Kind of like gazillion. We never hear that.
Yeah.
The other interesting thing is that the government is already spending 60% of what the total Medicare for all would cost.
Oh.
They're currently spending that much.
Right.
So that will be available to pay for Medicare for all.
Yeah. So we only have to make the other third. We only have to
because we're just talking about spending for the folks who are under 65 at this point.
Everybody.
Whatever
the government spends.
Well,
right.
yeah. I mean, we to get everybody who's under 65, we have to cover everybody 100%.
Right.
So,
right.
But we're not paying insurance companies a dime.
Right. Exactly.
and we're reducing the paperwork cost significantly.
Yes.
Yeah.
Doctors are going to be making more money because they're going to be spending less in the office.
Yeah.
They only have to bill one place.
Yeah. You know, I was also reading here that, I didn't know that the health system was supposed to be a jobs program, but here it says, this is what the head of the Democratic Congressional Campaign Committee says. She says, what we have, 130 million something Americans who get their health insurance through their work, the transition from what we have now to Medicare for all, it's just hard to conceive how that would work. You have so many jobs attached to the healthcare industry. It's like, because we're wasting money employing people, that means we have to keep on employing people doing things that aren't necessary. I mean, we could train people who have really high skills to provide more health care.
Right.
I mean, rather than doing the billing and arguing with us about whether or not they're going to cover us or not. There's all sorts of, a lot of these people are really skilled in things.
And the bill that has been proposed in the national, that I think they're going to be talking about.
This HR 1384 that's
yes.
going to be discussed tomorrow in the Rules Committee in the House.
Provides for wages up to 2 years for anyone who might lose their job in the health insurance industry.
Wow! So
it's fair.
So that's included in the 2.393 million.
I think it is.
Trillion.
Yes. Yes.
Yeah.
Yeah.
Wow! Right. So even that. So it's even cheaper than spending this 3.24. So this 3.24 trillion dollars, what is that going for? How can we be spending so much money and not covering everybody?
Well, 15 to 30% of it goes to an insurance company, and a big chunk of that goes to the CEO.
Yeah, and also to their assistant CEOs and assistant CEOs.
A very good share of it goes to paper costs, handling those insurance claims.
Right. Yes.
And in addition to what the insurance company pays, the individual pays a lot for that, as does the doctor's and hospital office. They have billers,
Yeah, and also I've mentioned before, being an employer, we have a payroll department that spends a lot of time an HR department, a human resources department that spends a lot of time trying to figure out how we can afford health care for our employees, and figuring out what to do when they have a baby, or when they get divorced, or when they leave. How are they going to handle their COBRA payments? Because when somebody separates from a job and they're able to, if they were able to afford their COBRA costs, they could continue on with their insurance for 2 years.
You won't have to even do that.
But it's so horribly expensive. Nobody ever. I've never seen anybody leave employment and take up the medical COBRA part, because it's so darn expensive. Because the employer picks up a large portion of those expenses, and so when the employer isn't there to pick up their part of the expenses, I looked at the cost of they at work they do a total. We do a total cost of the employee, how much it costs to employ people. The cost for the coverage for my family, $29,000 last year. Now I didn't pay for that. I paid a quarter of that. So I paid $7,000, $7,500 of that over the year. that doesn't include the copays and the
I was gonna ask,
and the deductibles.
'Cause I know you have a high deductible.
Yeah, high deductible, right? $7,000 or $8,000
On top of
on top of that. Yeah,
For
so
a person or for the family?
I think it's for the family. Yeah. But still, the thing is that you still have to meet your first $7,000, and that's not chump change, and $29,000 for a family of 4. I mean, it's just and I never go to the doctor. So the thing is it's so. But
so you work in the healthcare industry, and you're advocating don't go to the doctor because you can't afford it.
Yeah. Well, yeah. I mean, it's just. I mean, it's almost $30,000 to
not go to the doctor.
To not go to the doctor.
Hey, wait. Your family probably is paying close to $40,000 for insurance and healthcare.
Well, if you count in the deductibles and you count in the copays and that sort of thing. Right. Right. And it's because my daughters and my 2 daughters and my wife, they do go to the doctor from time to time, but I never do. And so it's just ludicrous. I mean, the thing is that actually Medicare for All would save money from insuring me, even though I'm 61 years old now. I'm just waiting. Tomorrow is my brother's birthday, and he's 65, so he gets to go to, he gets the golden ticket, And so I would just love to be able to have that as an option, being able to have Medicare as one of the options, because where we live up in Calaveras County, there's only 2, and and really the Blue Shield and Blue Cross are the two insurers who always vie for our business, and they're always within a percentage point or 2, and so you know that they're really not competing. They just know what the other person is going to charge, and they say, okay, you guys take them next time. And but it's still we're out in rural middle of nowhere, and so our expense are because we have very few hospitals and there's not a whole lot of choice. You end up just having really awful coverage for a lot of money. Yeah. So. But anyway, so I mean, the Medicare for All system would definitely be a
nice change.
A nice change.
Going back to the hearing that's going to take place tomorrow, I think people need to be forewarned that the Rules Committee is going to flush this proposal out of there totally. If you look at who they have limited the testimony to, the one Medicare for All or single payer advocate can't speak, so he's not going to be talking.
So what sort of testimony can that be then?
I guess he does eye blinks.
Oh my gosh.
He is in the advanced.
So this is the one person that they've decided can be the spokesperson for single payer.
Yeah.
And so who are the rest of them going to be? Are they going to be just advocating the Affordable Care Act? Which is
I think there probably will be one there. I don't know. I don't recognize all of them.
Yeah. Not horribly affordable.
Dr. Dean Baker, Senior Economist, Center for Economic and Policy Research.
Yeah.
Does that ring a bell?
Oh yeah,
to
definitely.
you?
We've run some articles, and he's a fairly progressive economist, and we've run some articles by him in Connections.
Okay.
So he's a good spokesperson. I don't know where I'm sure he's an economist, so he's not necessarily a single payer expert. Mm-hmm. But he's a progressive economist.
Okay, well,
I'll
chalk one up for our team.
Well, we'll see. Yeah,
that sounds pretty good.
Yeah. Dr. Sarah Collins, Vice President for Healthcare Coverage and Access, the Commonwealth Fund. Also sounds pretty good from our point of view. Let's see, who else? Dr. Doris Brown, immediate past president, National Medical Association.
National Medical Association probably has some vested interest in keeping costs where they are. I would think. I don't know. I mean, it seems that the nurses' associations are much more advocates for single payer.
Yeah. Dr. Farzan Navi, emergency room physician. I think he's limited to the experience of the emergency room and his.
You're turning people away.
Just how this would be in an emergency room, I don't know.
Well, you can't turn people away from the emergency room.
Okay. In his scope.
That's a costly thing for hospitals. Okay. So Medicare for All, for the hospital at least, that would be a way to increase revenue.
Okay.
Yeah, well, I'll get to this. So Dr. Navi is an emergency room physician and assistant clinical professor at Mount Sinai Health System.
Okay.
He's an advocate of a, quote, universal healthcare system. We have to watch out for that phrasing. Apparently for all the right reasons. It is reported that Dr. Navi's testimony is supposed to be limited to how patient experience would change.
Okay.
So it is uncertain whether or not he will be able to testify on behalf of single payer.
Okay.
I can speak to the other people. I can give you a
Yeah,
little more
well,
detail on the others if you're interested.
Well, there was in that was a Huffington Post article, right? You were reading before, or
before I was reading from something from Huffington Post.
Okay.
This is
Right.
from
but there was like some criteria that said, well, you know, what are the 3 criteria for people to testify in this group, and one of them was that they could not be a spokesman already for Medicare for All.
Right. They couldn't be a leader.
A leader.
A leader in a group that advocates for single payer.
So there's a specific leader who you mentioned who was very noteworthy.
Yeah, Adam Gaffney, president of Physicians for National Health Program.
So he's not going to be allowed.
He's not
to
going to be
speak.
able to talk.
Yeah, and then they couldn't allow activists.
And then
Actually,
they can't be a leader of a single payer group. They can't even be an activist.
An activist
at all.
So that means at all. I mean, that means you could never have spoken in favor of, like, we would all be activists, right? So
don't ever carry a sign or knock on a door. Yeah.
Don't even.
And then the third criterion was: has this person said anything negative about the Affordable Care Act?
Oh.
Anything at all.
And just about everybody I know said something negative about the Affordable Care Act.
Like how much tax you pay to support those premiums that get reduced.
Like it's
people.
not affordable, yeah.
Yeah. So that's a gift to the insurance companies.
Yeah, right.
So that's another cost that we don't even look at occasionally,
Yeah.
is the increase in tax that we pay to give those knockdown premiums to people who can't afford the Affordable Care Act.
Right.
Well, I mean, that's not the portion of the Affordable Care Act that I have a particular complaint with. I mean, I don't want to get off on a tangent about the Affordable Care Act, but I will say
the subsidy.
One portion of the Affordable Care Act expanded Medicaid to cover people who make up to 135% of the poverty line.
Right.
And it used to be you had to be a certain number below it or something. So it gave coverage to, I don't know, an additional 10 million people.
And that was funded by a tax on medical devices
and people who make an income over a certain number. I mean, and that's really been the driving force behind the dismantling of the ACA.
Right. Because
the wealthy people who don't want to pay that tax.
Yeah. Well, because it's the only way that low income people can actually afford to have any sort of health care at all. I mean, the thing is, if you didn't have that transfer of income to this bloated system, you couldn't. A lot of people couldn't afford even basic care, or couldn't have any insurance at all. So there has to be. I mean, and you know, generally that's what taxation is. It's a transfer. Anytime you have a tax, you're transferring funds from one place to another. You know, and so in this case, it's pretty obvious that, you know, you have a high income tax on really high incomes that end up providing the funds for the subsidy.
But there are other aspects of the Affordable Care Act that are not that. And those are the ones that I think are more legitimate complaints.
Yeah. Well, the lack of cost control. I mean, I think that was when that first passed. I was pretty much saying, well, this is nice because it'll expand coverage to everybody. That's when there was the individual mandate, when you were required to be covered.
And they were kind of batting that around for 5 minutes.
Yeah. And the problem was going to be cost control long term, because once everybody is covered, I mean, the insurance companies now have all this extra money, and now they're you would think that they're full, but no, we need more money. So now they're just going to start cranking up premiums, and this next year I would guess that we're not going to see a whole lot of premium increases from Blue Cross or Blue Shield, because they are going to be worried about programs like this that would put them out of business.
Yeah, they're going to try to look pretty appealing.
Yeah.
Good time to get your knee
Yeah,
replacement.
that's what happened last year. I mean, last year our premiums
didn't go up.
Well, they went up like 1 or 2%.
A lot less than
they normally have.
Yeah. Right. Well,
when the pressure is off, they'll increase the rates while they can, and then when the pressure is on, they'll just keep it low.
Yeah. So far, our pressure has gotten us to the point where we're at least having a hearing.
Yeah.
It may be an unfriendly audience. It may be cherry-picked witnesses, but we are having a hearing.
That's right.
In Congress, in front of the Rules Committee for Medicare for All single payer.
Okay.
It's a beautiful thing.
It is. Now, this is Peace and Justice Connections. We're talking about Medicare for All with Max Heinemann and Kathy Mathis. And we're on the eve of the first of hopefully many House hearings. We'll see if it's of many House hearings on the Medicare for All, because it's becoming more and more popular. People are thinking that Medicare for All is a real possibility.
Well,
That's kind of encouraging.
When you look at the potential Democratic candidates,
yes,
I haven't counted up, but I think half of them or more. Actively have said they support Medicare for all.
Yeah.
Well, many have co-signed Bernie's bill.
Yeah,
right.
the senators have. Yeah, right.
Representative Jayapal's.
Yeah.
Of the, one or two
House
representatives who are in the the pool.
Yeah, Tulsi Gabbard or Swalwell or Moulton or whoever else, but yeah, it's hard to remember. I mean, there's 20 of them now.
Yeah, right.
Now, the big excitement is, this week, at least within the corporate media, is that Joe Biden, the great Joe Biden has jumped in his candidacy, and so he instantly becomes the front runner supposedly. But his stand, I've not heard of what his stand is on healthcare for all. Yeah.
He's against Trump.
Yeah, there you go. Yeah. That's been his primary.
Yeah.
That was I think that was Hillary Clinton's claim to fame, is that she was against Trump, and that's I guess she thought that was going to carry her, but really. Issues like this is what's going to carry, to my mind, is what's going to carry a Democratic person to more popularity.
And you'll notice Joe Biden hasn't said anything about health care. Well, he's for health care, but
yes.
He
after all, he's 76 years old. I mean,
well, he's got Medicare.
Yeah, well, I think he has something better. I think he has like some sort of retirement senator type of thing that I bet gives him
him for life.
Yeah, gold-covered cast when he breaks his pinky, but. Yeah,
but Biden hasn't said anything, and probably isn't going to.
No.
And,
well, I think he may have to. There's going to be debates in a couple months, and I think, I think that's going to be a topic, because the Democratic Party has made it a topic. Actually, the person who's made it a topic is Bernie Sanders has made it a topic.
Well, I think it's in the platform. I think it's in the Democratic platform.
Yeah, and that's pretty impressive, for somebody who's not really a Democrat, to actually have that much influence. In fact, we have. The article in Connections on the top of page 5 is "Now is not the time for compromise on Medicare for all." It's written by Bernie Sanders, and it's talking about how now is not the time to compromise. Now is the time to push the issue.
That's the absolute crux of the argument when you talk about, this many of the Democratic candidates support single payer or support Medicare for all, and this many, like the status quo or whatever. But of the group that declare their support for Medicare for all, I'd say at least half of them would cave in a half a minute, and decide to do some public option thing, or let's just lower the age to 55 and go about this in a slow and easy fashion and not upset the apple cart. You don't want to make the CEO of Blue Cross mad, and there are people who depend on those.
We have to be wary of what those compromises are.
We absolutely have to be wary of them.
Right. Yeah, because I mean, it's sort of like right now we have people are noticing. I think people have been noticing for years, but it's like folks would say, "Oh no, that's not possible. That's the politics aren't there." I mean, nobody would ever go for healthcare for all, but or for Medicare for all. But now it just seems that, a tide is sort of turning, and people are saying, well, it's possible. And once it becomes possible, then people start actually looking into it and seeing if it's really feasible. And what we have to do is keep on pressing these facts that say that it's cheaper to cover everybody because we have to cut out the middleman and make certain that we're able to contain costs. And right now, unfortunately, regrettably, with the House of Representatives still controlled by Democrats, there's still this big money concern. I would guess that has to be the only reason why the Democrats would not be openly giving an open hearing to a Medicare for all in a hearing like tomorrow. I mean, you would think that there would be at least half of the people who are testifying there would be experts on Medicare for all, and they could dispel some of these falsehoods, talking about how much more expensive it is to keep our current great system that doesn't cover everybody.
Yeah. That is the worst healthcare system in the Western world.
Yeah. Joe, there's a news item. We just see that Joe Biden backs a public option, not Medicare for all, as he argues for electability. So, yeah, that's from BuzzFeed News, and that's a post from today, the 29th of April. So
now we know
a public option. So what
surprise!
So what does the public option mean? Does that mean like where I would have a choice of Medicare for all when I'm looking at Blue Cross or Blue Shield?
Not necessarily.
Okay.
Public option would be that the government would offer some sort of it would offer some sort of insurance plan that would compete with other insurance companies. It's not going to reduce the paperwork and the all of the
network, in-network, out-of-network.
So it would still just be one more insurer.
One more insurer, but the big companies who are making a lot of money actually favor the public option because they want to send all the people who would cost them money to the government to pay for.
That's right.
They just want the relatively healthy people who can pay high premiums.
They just want to cream off the
cream.
But they're going to complain that the government doesn't charge enough for the public option.
So like Medicare. Medicaid. I mean, because Medicaid isn't Medicaid
right. They're going to say that we can't take those patients because the government isn't going to pay enough for the visits.
Right.
We can't make a living.
Right.
Yeah. Well,
right.
They'll keep their waiting rooms pristine.
Yeah.
The thing is, people don't realize that there's a lot of insurance company money in Medicaid or Medi-Cal. That quite often people will get Medi-Cal and the local welfare department will run that through an insurance company. Well, now that the insurance company charges the government for that. So they administer it. So the insurance companies are administering a good deal of Medi-Cal. Sometimes they pay an acceptable amount and other times they don't. So it's something that, the doctor's office has to be aware that when, somebody comes with their Humana card or their Blue Cross card, that may actually be Medi-Cal. Now that takes a genius at the receptionist level to have those all.
To have all those different copay, like which doctors are covered, what labs are covered, what what drugs are covered.
Which ones of those Humana or whatever it is a Medi-Cal that isn't actually going to cover the doctors in their office, whereas some other Humana Medi-Cal plans may.
Right. They're looking for the asterisk.
And that changes every year, doesn't it? I mean,
every month.
I mean, because a doctor's group could drop off of a Humana, one Humana thing, and then be picked up and then pick up like an Anthem Blue Cross somewhere else, or I mean, so it's shifting as
it would not get rid of that bureaucracy. When you hear about layers and layers of bureaucracy, we're talking about people sitting in back rooms with phones going, are they in network? Are they out of network? How much are they going to have to pay on their end? What's the deductible? What's the copay?
I had heard that, the Medicare for all, limited choice. limited your choice of doctors. But
not true.
No,
everybody will be in
everybody
the
will
network.
be covered.
Yeah.
I think people
well,
can't
all the
conceptualize.
doctors will be in that provider's network. Because there's only going to be one provider.
One network.
And everybody's going to have a card that takes them to any doctor who will accept them. Now, you can't, you may not be able to see the doctor you think you want because they may be full.
Yeah.
I mean, I'm not.
Or you may have had a bad experience with them, and they've had a bad experience with you, and they're going to say no thanks.
I mean, they'll have to work that out.
Right,
but the business of, no, you're not in network, or they're not in network, or, you'll be able to pay for this one, but not for that one. I mean,
and doctors will not be allowed
these days.
to, you could have doctors who take cash money, private pay, but they can't take Medicare and Medicare for all. They would not be allowed to do both, because that would set up a dual system in the office. You'd have the private pay, cash people, and the Medicare for all people.
Well, I think it's the services. And I don't know how you would do it. Say a surgeon provided cosmetic surgery for cash that's not covered under Medicare. But anything Medicare covers, a doctor can't charge cash for somebody else. They have to accept the Medicare payment only.
Yeah. I just think that folks in this country just have no concept of what a Medicare for all system would be. I mean,
and how much it would save.
Yeah, how much it would save, and how liberating it would be, and how that you wouldn't have to worry on a day-to-day basis whether or not you're going to become bankrupt because you have something wrong with you. It's just such a concern. And I'm fairly healthy, and I don't lose sleep at night. But I'm sure there are folks who do have chronic illnesses and things who are really concerned. I mean, I guess if they've met their $7,000 or $14,000 deductible, they feel like they're free and clear. But
I'm still waiting for you to get Medicare for all, so you can get that prostate exam and that
what is it called?
Colonoscopy. You're waiting on those.
Well, the thing is, I probably should do that, but it's
yeah, you should.
Yeah, you should, but I just don't. But yeah,
we're going to eliminate the cost as your excuse.
Yeah, there you go. Yeah, well, then it's just the time effort.
Yeah,
and time.
And
because for me,
comfort, get it out of your comfort
zone.
I
mean, I don't even have a primary care physician.
Right.
And I won't even know how to go about doing that, in terms of calling up somebody and saying, well, do you have any room in your office or something?
Can I come in for an annual?
An
annual
checkup.
Physical, a checkup.
Check my chest.
Haven't been seen for 40
Ever.
years. Yeah,
really. It's like a confession.
Come on down.
That's right. Yeah.
We'll book you for an hour and a half.
Forgive me for I have sinned.
Maybe you ought to do that before we get Medicare for all, and there's a lineup for those doctors.
Yeah, well,
there's going to be an awful lot of backlog to take care of.
And that's not a bad thing. I mean, because the thing is, there's a lot of people who are needing to see, and you can see that whenever there's a Susalud or there's some sort of community health fair or something where people need to have get a blood test or something, and the line is very long. And
particularly in the world of dental care.
Yeah, in dental care.
Yeah. And there's just a lot of people who need some dental work.
Well, and we often look at the Canadian system as something we would emulate. Yeah. But friends who live in Canada, her primary care physician retired a couple of years ago. She has been unable to get a new regular primary care. Hasn't limited her health care. She can see a doctor at any time. But to have be a primary care physician who she sees all the time or is responsible for supervising your care, she hasn't been. She's on the list, which since 2 years. Yeah. So they have that. Well,
it's not perfect.
Right.
But well, they also have the ability to maneuver a little bit more. I think if they want an influx of primary care docs, that they could put the money there.
Right. Yeah. Right. And we were talking earlier about one of the problems of our system is I just feel like that there is there's not enough supply of medical personnel, of doctors. Of it could be even family nurse practitioners or physician assistants. there's a lot of people who want to go into the medical field, and they're limited by, they have 4.0s and they have all these different internships and stuff, master's degrees and stuff, and they can't get into med school. And so the thing is that the amount of doctors who are metered out of the system and then who go through a residency program, which is also, it's almost like a living hell, because and so doctors come out of that having worked 60, 80 hours a week, they've gone through the ringer. And so why do we have to do that to doctors? Why can't we just have a system where people who want to get into med school can go there, rather than stealing the best minds of less developed countries and taking all their doctors who are moving here so they can increase, so they can fill the demand. There are a lot of doctors from other countries. Those other countries need doctors too.
It was a clear policy choice to import rather than train our own.
Yeah,
and it's been detrimental for patients, for the population here, for people who want to be doctors who live here.
Because I think a lot of people just sort of think, well, I guess this is the status quo. This is how many doctors we always have every year. It's the same. It's going to be the same forever. This is, even as everybody's getting older and older folks are going to need more doctors, like, I guess we need the same number of doctors. But, at some point, or maybe there's a ratio that maybe they're graduating more, but it's not enough to meet the demand.
Right.
And so
it's not going to be enough to meet the demand when we have Medicare for all.
Indeed. Yeah. So I'm hoping that this whole process also thinks through the idea, the supply of medical medical personnel, because and this, we're talking about, there's you have so many jobs attached to the healthcare industry. Yeah. But why don't we get those billing people, or how do we get some of those folks to be medical assistants, or maybe those skills don't necessarily transfer, but they understand medical terminology, and there can be something in there in the system where those folks can be employed to serve the additional demand.
Well, and just to speak to that particular issue, there are provisions within definitely within the Jayapal bill to
Jayapal being the HR 1384,
to retrain people who would be displaced.
Yeah, and you were talking about like the folks, the 2 years
whether guaranteed their salary for 2 years.
Yeah,
and plus the training.
That's the training. Yeah. The transition. The excuse that what are we going to do with the remnants of the old system, because we just can't change. It's like your hands are gripped to the steering wheel, and you can't steer out of the rut that you're in, because you're just deathly afraid of that we can't somehow adapt.
And one of the things that blows me away, I listen to the news quite a bit, and I have yet to hear any news commentator say that Medicare for all is possible. They all say it's not possible. It's too much of a change. It's people don't want it. I've yet to hear anyone speak favorably about it in the local paper. Or in the national news.
Well, I think we've mentioned it before. You look at the national news. You ever look at the national news between 6 and 7 o'clock? Gee, who's advertising on the national news? It's drug company after drug company. They're either that or insurance, or insurance companies, Geico or whatever. But generally, it's drug companies who are pushing their whatever product. They say, well, ask your doctor, ask your doctor about this. Do you have this, some really off the wall disease? Well, ask your doctor. You might have this disease. They seem to totally fund the news hour, and so that's the hour that pretty much. I hate to say it, older folks watch news. Most young folks watch it on YouTube or whatever, wherever they can get it, Facebook or whatever. But
that's where you should get your healthcare news.
Oh yeah, well it's just as good as NBC, because the thing is the corporate funded news. they come up with, they're not going to bite the hand that feeds them. When was the last time you saw NBC come out against nuclear power? Well, you happen to be owned by a company that runs nuclear power plants. I mean, it's, there has to be an understanding that the messenger has a vested interest in the message,
Really?
And yeah. Whereas Connections, we have very few advertisers. Now, if you want to advertise, you can advertise in Connections as much as you want, but we are not funded by any sort of Merck or whatever, Pfizer. And those folks have deep pockets, and they are deep in this system. I mean, the medical, the cost of, like, say, an EpiPen, or even of insulin now, or any of these basic things that people need to survive, have gone through the roof just because the market is allowing it. It's just
it's criminal.
It is criminal,
immoral. It's cruel.
Yeah. But yet people say, well, we can't afford, we can't get out of this rut. What happens if we change course? Right now, if we don't change course, many more people are going to die. Many more people are going to go bankrupt, and many more people are uninsured. So they're all out. They're fearing for their life and fearing that they have to stay with the same job just because it pays for their benefits.
Mm-hmm.
Well, many people are underinsured.
Yeah.
Yeah, so many.
But
because that's all you can afford.
Yeah.
Well, but if they left their job, which is providing the insurance, they certainly would have a gap. Even if they look for another job that has good benefits, if they quit the one they are, their last day there until they're covered under the new job is going to be weeks or months.
Right. Yeah, because a lot of new jobs, even if you go from one job to the next, you have a 90-day waiting period. Yeah.
Better not slip on a banana peel in that period of time.
Indeed. Yeah. And also, sometimes with our open enrollment at work, which is in December, sometimes, they'll give us the rates like on November 30th or something. We're supposed to enroll everybody in 10 days. And so people are supposed to make all these decisions really good because they don't roll out their rates until late because for whatever reason. I don't know.
There's a reason.
Yeah, I'm sure there's a reason. And so the thing is that, and then, people sort of straggle in, they get their enrollment cards. And so the thing is that sometimes people won't have their insurance cards by January 1st. Oh. So what happens if you get hit by a car on January 1st and somehow you don't have a valid insurance card, and that's the first thing they ask you when you roll in.
Their insurance?
Oh yeah. And sometimes it's months to get that card.
Yeah.
And we can call in the office, and they say yes, they're covered. Well, what grew,
Yeah.
But sometimes
your doctor isn't on this list.
Yeah. And sometimes when you call, they won't have them listed. And the patient is standing there saying, yes, I am.
Yeah.
And they expect the doctor's office to accept them based on that.
Yeah, based on maybe the HR department said, yeah, you're covered, but then there's a slip up, but in 1 week or something where
that's the
T didn't get crossed.
That's the entire story, January and February.
Yeah, it's a mess.
Every year.
And but with a single payer system, you're
none
covered.
Of that.
You're
none
covered.
Of that at all.
Yeah,
you get your card when you're born, and you
don't
give it back
dread
when you die.
don't dread January 1st and see, gee, I hope I'm covered with this horribly high deductible that I can't afford.
Quit your job and go get another one.
Yeah.
You take a vacation. Yeah, whatever you want.
Like most of the other developed countries. All of the other developed countries. There's no other country in the world that has a system like ours.
You can retire when you want.
Yeah. And the thing is that's that's also a benefit for young people, is that a lot of older folks might be holding on to their job just so that they can keep their health insurance, and so they're keeping somebody else, a younger person, from being able to come into that job. And there's a lot of young folks who are just very frustrated coming out of college, and they can't get their first job because the system is clogged up by a bunch of old folks who are waiting for Medicare to kick in.
We're waiting to turn 65.
Turn 65. It is just, the system is just designed to benefit, a few very wealthy insurance companies, and then also some other drug companies or medical device companies or whatever that are able to crank up able to increase their prices because insurance covers it. But if you look at it, insurance means we're covering it. There's no magical, big pot of money out there. I mean, we all pay our premiums. We all pay the copays. So if there's a huge disaster, the insurance companies just next year just increase their rates in order to cover the costs of that disaster, and with a profit. With a 5 or 10% and whatever profit they want to put on there. And so there's when people say, oh, don't worry about it, insurance will cover it. Well, no, you'll see that increase next year when your premium goes up 6% instead of 4%. We'll all end up paying for it. So it's
so
good to hear that. It's nice to hear that there's a hearing coming up tomorrow.
Yeah.
And so what after that hearing?
Yeah.
What are we able to do? Are we able to call our representative and say, hey, back this 1384, HR 1384?
Well, and talk about some of the myths that were put out during the hearing, that it actually Medicare for All saves money. Like somewhere in the neighborhood of 19%. And
while covering everybody.
You're anticipating some
so hopefully
misinformation.
The Democratic leadership are the people who are putting it out.
And they're gonna spill out these huge dollar numbers and say we can't afford it. It's too much to change at one time. All of those things we've heard before. And I certainly would encourage people to call their representative in the House and tell them that they know it's going to cost less.
Yeah.
And also your newspaper. And
write letters to the editor.
And say why aren't you having articles in the newspaper about it? Why aren't you quoting Bernie?
Yeah, Bernie
and who's the other one?
Well, there's a Waleed Shahid who's a spokesman for a progressive advocacy group, Justice Democrats. It says as the leading Democratic presidential contenders increasingly unite around Medicare for All and the Green New Deal, I don't understand why the chair of the Democratic Congressional Campaign Committee is trying to divide Democrats by putting forward talking points from Republicans and insurance corporations. And so that's exactly it. I mean, what the whole idea is to divide folks and to get them to mislead people into thinking that a Medicare for All system is unaffordable, and it's not.
Well, and if we get that, we might want a Green New Deal.
That's right. Yeah, because who knows what might be possible.
And then we might want free college.
That's right. Yeah. That's right. Yeah.
And forgiveness for our student loans.
There you go.
I mean, there's just
never
ending.
Yeah. Well, and the thing about each of those things is what it does is it puts money in the hands of people who are of moderate incomes. And it may end up costing higher taxes on well-off people, but that has an impact on the economy that is expansionary. Yes. I mean, when you cut taxes on well-off people, they don't have to spend that money. They don't buy more stuff. They maybe buy more stock and the stock market goes up, but that doesn't add a penny to your local economy. But if you cut taxes, I mean, if you maybe raise taxes on people who are making $1 million and take that money and you put it into a system like a Medicare for All system where people are able to go to the doctor, that puts money in the hands of people who are going to use it. Because
people are going to start going to the doctor.
They start going to the doctor, and that will go into the doctor's office, and the doctor's office, the people who are in that office will then spend that money through a multiplier effect. There's the demand side of economic stimulus is the typical way that we use to expand this economy, not the supply side where you give it to well-off people and hope that they invest it in businesses. And so by putting more money in, like what you're saying, in terms of student tuition or forgiving loans. So if students are forgiven loans, then the money that they're not paying the bank or paying off those loans, they can use that money maybe for a down payment on a house, or maybe they can actually spend money in going to a movie, or maybe buying food. I mean, so the thing is that when you don't have low income people strapped for economically, they actually are given some fun, or actually have funds to use.
They spend it in the local economy.
That's right.
It generates the local
That's
economy.
right. And you don't worry about a recession because you know that the people who have the money, they have to spend it because they have to spend it in order to survive. So, a lot of the stuff that we're talking about, the Medicare for All is one thing, because right now the Medicare for All is very regressive in terms of where the funds go. It goes up. It goes up to very well-off investors, or to people who are CEOs of insurance companies, or folks who are already very well off. The expansionary area of Medicare for All is the same as a Green New Deal, where you increase the minimum wage, or you're increasing, if you're forgiving student loans. It all puts money in the hands of people who are going to spend it in the economy, and that's going to be really good for jobs. That's the economic case.
Well, I appreciate that.
In general, Medicare for All will decrease the health care costs of private households and private business by 9.6%.
Yeah, because you hire these folks who are worried about enrolling folks. You don't have to, the employee, like I'm saying, my coverage costs $29,000, and the company pays 3/4 of that. So 3/4 of that, if there's a tax or whatever, let's say we called it a premium. Instead of calling it a healthcare tax, we called it a premium that they would pay to a single payer system rather than paying it to Anthem Blue Cross. Maybe people would be more accepting of it, because that's what they think their Medicare tax goes for now. But really, you can think of Medicare for All as being, a premium-based system. We just have to, it's a sort of a forced premium rather than a tax, which I guess would be a distinction without a difference.
Well, but semantics are important.
Yeah.
In Taiwan, they called their tax for their single-payer system a premium.
Yeah.
It makes the medicine go down.
Sure.
A lot better.
Because that's what people are used to. It's a premium without a deductible, without a copay.
And you get much better service,
Yeah.
much better coverage.
Yeah, and your drug costs will be cheaper. They'll just it's just getting over this hump. And right now, I mean, it's nice that we're getting a hearing in the House.
We're getting a hearing.
But
I hope it'll be on C-SPAN. That I don't know.
It's taken this long, and the thing is it's sort of a.
It will be on C-SPAN. Oh, thank you so much.
So it's wonderful.
Yeah, so here on the West Coast, it'll be 9:30.
The other way around.
It's be 9:30
there, 6:30
It'll be
here.
6. Okay, well.
Yeah.
I'm gonna check it out. I'm pretty excited.
Yeah. Well, yeah, because but there has to be follow-up, because the thing is just getting the first hearing. You would hope that we would have had hearings on this when the Affordable Care Act was being debated.
Single payer advocates were absolutely shut out.
Yeah.
I mean, it's well documented.
Yeah. Well, the thing is
they were carried out of hearings,
Yeah.
screaming. It was bad.
Yeah, and the thing is that when I'm not going to speak one way or the other for Democratic candidates, but Biden with his public option, that's what you're getting. I mean, the Obamacare Biden plan is perfectly fine. He'd be perfectly fine with that in terms of not having a Medicare for all system. You could think that if you had a Biden presidency, we would not have Medicare for all.
Well, and absolutely, that's going to be the thing he comes to the table with, and he'll give half of it away.
Yeah.
And he will never fight a minute for anything beyond that.
Right. Well, whereas there are some people who are fighting, I mean, they're more. I mean, I think Bernie's the biggest fighter for
Bernie's the
Medicare.
man.
I mean, there are other people who are saying
there are a few who are
jumping on.
Close. Yeah.
Oh, Elizabeth Warren.
Yeah, she's
right.
amazing.
Yeah.
She's
So
amazing.
the thing is that this, to me, this is the most important issue. That this and climate change are the two most important issues in the next election. And you know, if
this one really seems to be galvanizing people.
It should.
I mean, even the Fox audience, when Bernie was on in an interview, the Fox host asked the live audience how many of them would be willing to give up their employer-based health coverage for Medicare for all. Like 80% of the hands went up. They were shocked.
Yeah. I mean, it affects everybody, and everybody knows that sooner or later they're going to need health care. And they worry, you know, it's just a worry.
It's that underlying worry. I was watching Masterpiece Mystery last night, and it's, you know, contemporary England, right?
Yeah.
None of those people have this worry.
That's right.
None of them do.
Yeah. Well, so Ed, we've used up an hour here, and it's been, but
So,
it's been
which Masterpiece Mystery did you watch?
Yeah, it's the first time I watched it in a while. But I mean, it's contemporary England. People over there do not have this concern.
They don't have to worry about it. Yeah. So
I don't know what they do with their time.
Yeah, well, tomorrow we should be watching C-SPAN at 6:30, the first hearing on HR 1384. You can rely that your next connections will have a lot of stuff on Medicare for all. We've been having a nice, arousing discussion with Max Heinemann and Dr. Kathy Mathis. I'm Bruce Giudici. This is Peace and Justice Connections. Good night and have a nice evening.